Okay, so I'm going to talk about the OCEANiC study quickly. Now, this study's been open for some time now. So just a very brief overview. This is a study that is looking at, it's a phase 2 open-label multi-centre trial of Osimertinib with or without adjuvant chemotherapy guided by NGS co-mutation status, ctDNA detection in patients with stage 2 and 3 EGFR mutant non-small cell lung cancer. So it's building on the ADAURA trial and the gaps that were there in ADAURA. One of the gaps was around brain metastases. So this is the schema. You'll notice that all patients need to have a brain MR. One of the other gaps was around less common mutations. ADAURA only included L858 and exon 19 deletions. This includes all EGFR mutations. You can see we're looking at all activating EGFR mutations, that is. And you can see we are post-operatively trying to do a ctDNA assay, and we're also doing next-gen sequencing on the primary tumour and then allocating into one of these two cohorts, either Osimertinib alone, if we feel that the risk of recurrence is low compared to standard of care, which would be chemo followed by OCI, and the primary outcome is disease-free survival at 3 years. We're also looking to expand the study, so it's currently open across Australia. We're expanding to New Zealand, into Laird's site, and hopefully also Wellington, with activation plan for hopefully in a few weeks, actually. Mildura is also coming on as a teletrial site. There's a couple of key amendments. We sort of listened to some of the comments from you, and we've changed some of the timelines. So one of the real problems with this study is you needed to really see your patient pretty soon after surgery to then collect the ctDNA, to then be in time, to get a result in time to determine what sort of adjuvant therapy your patient was going to have. We've sort of broadened those timelines because it seemed like that was a little bit too tight. We're also going to increase the screening assay timing. So within 56 days, it was previously 31 days. So hopefully this isn't going to change too much, and will make it easier. So the benefits of enrolling onto OCEANiC, we will give you the NGS report, so you'll know about the co-mutations. We can't give you the ctDNA report because initially they're just going to give us a positive or negative, so we won't have the rest of the report until much later. But also the other thing is OCEANiC allows you to use Osimertinib off PBS for 3 years. Which then means, and we have the same problem at OSI on the PBS, is once in a lifetime. If there were to be recurrence, you wouldn't be able to use it in the metastatic setting. So this does give your patient the option of then using Osimertinib on the PBS should that be needed. This is where the study's up to. It's we're actually tracking quite well. You can see there's pretty much all of our sites are active apart from Auckland and Mildura. We are up to 37 out of the 100 patients that we're looking for. So thank you to all of those who've contributed. But you know, I think we've ironed out a lot of the issues with the trial, and we're as I said, we're on track to completing. We need 45 patients by the end of the year, so hopefully we'll get to that number. So thank you again to everyone who's thought about the trial and is contributing to the study.